Got the digits, but all I need is the line. And West End girls give boys just all they need. If you find a good girl, gotta treat her like a queen.
This is Dr. Thornley. I'm a neurologist subspecializing in epilepsy, and today I'm going to go over the role of vagal nerve stimulating device and its role in control of epilepsy. So to epileptologists, once somebody has already reached 2 medications, then the likelihood of coming off medications becomes less and less. So that's where the role of vagal nerve stimulating device comes in, and it was found that it can reduce seizures of up to about 50% in some trials. So the mechanism is that there's a cardiac implant and then there's a wire coil around the vagal nerve. So anytime there's a stimulating device, you need 2 points. So there's an electrical charge in between. So there's an electrical impulse and then it goes up to the brain. And currently the thought process is that it could be due to desynchronization of the brain, because with epilepsy, there's abnormal currents, it synchronizes, and boom, you get a seizure. You have clinical manifestations from that. So there's desynchronization. There's also increased GABA, which can inhibit glutamate, which is excitatory. There's also increased serotonin, and then noradrenergic neurotransmitters from the locus ceruleus, and then serotonin from the raphe nucleus. So these neurotransmitters are thought to interplay with the control of seizures. And so there have been some studies regarding the effectiveness of vagal nerve stimulating device, and then in a study by Morris in Neurology to the 1999, there are 5 clinical trials which examined 454 patients, which found that the vagal nerve stimulating device reduces seizures by about 50%. So after 1 year of being on the VNS, vagal nerve stimulating device, it reduces seizures about 50% of patients, 50% reduction. After 2 years, there's a 43.2% reduction, and then after 3 years, there's a 42.7% reduction. And then the most common side effect after 2 years is hoarseness, and then headache. And then after 3 years, it's shortness of breath, because the vagal nerve subserves the throat muscles. And then in a study by Elliott in 2011, they studied 436 patients between the ages of 1 to 76, and they also found 50% reduction of seizures. In 90% of patients, in 90 patients, there was about 90% reduction, and then 162, there was greater than 75%. And then in 255, there was 50%, and then less than 50% in 145 patients. And then there was permanent damage in 2.8 patients, or 11 out of 400. There was also incidental findings of weight loss in another trial. So there was trials that looked into this, and they found that in one study in 503 patients that when they did placebo control, meaning there was no stimulation used, and then the vagal nerve stimulation device, there was no statistical change. However, when they would check see if the stimulating device was working, so they had to do the wires, make sure that electrical impulses were being propagated. Post hoc analysis was thought that with these checks, it may have facilitated some weight loss, so that it's not that there's a statistical difference. It's just that both the control and the group with the VNS actually both had weight loss. So 17% in the treatment had weight loss, and then 16% in the control group had weight loss. So it was pretty even, and it's because they checked out the vagal nerve stimulation device. And then there was also a study by Sir Daroglu in 2016 that also showed that there was long-term benefit after 5 years for the vagal nerve stimulation device in 56 pediatric patients, and then of those, 11 out of 56 were found to be seizure-free. And this was a study over 2000 to 2015. So in summary, the vagal nerve stimulation device is still quite a valid treatment option in the toolbox of an epileptologist, and many patients tend to be hesitant because it involves surgery. You can't get an MRI of the brain, but there's something to be said about this treatment option. And the way it works is that when you have the cardiac implant and then it sends impulses through the vagal nerve, you pass a wand over it so that it causes the magnet to trigger, and then it sends impulses if needed. It's also set at a certain amount of electricity and a certain frequency so that it continuously gives that impulse and stops the seizures. So, and the battery life is about 6 years and has to be replaced. There are newer models right now, and I find that I'm not encountering as many patients as I used to, as opposed to when I used to work in an academic center. So this is a treatment option because there's a lot of conventional agents out there, conventional medications. And I have found, just as an editorial, that the newer medications, they tend to be stronger once a day, but I found that they tend to also have more side effects. The older agents have lots of side effects. The middle of the pack ones are fairly well tolerated, and then the newer ones, although they're touted to be better, just in my opinion, my clinical experience, they also tend to have more side effects. So the vagal nerve stimulation device is still a treatment option for effective control of seizures for about 50%, and it's even effective up to 5 years. So this shouldn't be something that should be feared, but welcomed as another alternative treatment. Okay, so I hope that overview was helpful, and this was Dr. Thornley, May 11, neurologist, epileptologist, signing off.